Good morning, everyone. And today we've got Sinopol back with us, and Sinopol is actually going to introduce the change in the product that they have. They've obviously made it a little better and a little easier for us, and they're going to talk to us, run through that with us. So thank you, Anne and Kristen, from Sinopol. Thank you very much for joining us and doing this for us. And so I'm not going to do anything else or say a whole lot of things. I'm just going to hand it over to you guys, and you can go ahead and tell us more about Sinopol, what it does, how it helps us. So I can't wait to hear that. Thanks very much, ladies, for joining us.
Thank you. Shall we start off with a quick introduction?
Yeah, sure. So just maybe from my side, I'm Kristen. I'm the responsible pharmacist at GDC, and we recently, well, since last year, acquired the Sinopol brand. So very exciting news for us.
And I'm Anaya Ovenga. I am a project manager in new product development and yeah, all sorts of things innovation.
Awesome. Thank you very much, ladies. So we're going to start. I'm going to ask the first question, and then I'm going to leave it up to you guys to carry on. And what is Sinopol, and what is it used for?
Perfect. So maybe if we can take one step back first. So you chatted about the innovation in the brand. So firstly, for those of you who know, maybe we can go to the next slide. Sinopol, you might have seen it or used it before. So just a reminder that we've actually rebranded the product. So we've aligned more with the global branding, the look and feel, but a bit more clean and clinical. And maybe for those of you who don't know Sinopol, if you remember one thing, you can remember our slogan or our tagline is bring back the balance. So Sinopol brings back the balance.
Awesome. Thank you.
Perfect. So what Sinopol is, it's a health supplement. So we know that health supplements complement your innate healing system. So it supports your own body's healing system. It's a health supplement available without a doctor's prescription. And we have got 13 proprietary clinical studies on Sinopol itself.
Okay.
What Sinopol does, Sinopol restores the balance, so bring back the balance, especially in patients with PCOS or polycystic ovarian syndrome. So remember, PCOS is caused by multiple abnormal follicles in the ovaries that then causes hormonal disorders. What it also does, it brings back the balance with metabolic, terminology, apologies, metabolic abnormalities, promoting healthy glucose metabolism, so things like insulin resistance, and then also further hormonal imbalances and metabolic abnormalities is corrected, such as excess weight gain, dyslipidemia, and hypertension. So we know that there are risk factors connected to each of these. So excess weight, we know causes type 2 diabetes, heart diseases, dyslipidemia, high cholesterol. We know all the risk factors with cholesterol, and hypertension, obviously the high blood pressure. It also reduces oxidative stress. So it clears our bodies of free radicals that are obviously bad. We know obviously all the hypes around antioxidants as well. Then just here, maybe a few signs and symptoms to look out for. So these slides were more connected to patients who already have PCOS. So there's insulin resistance, hormonal imbalance, hyperandrogenism, and oxidative stress. So the studies found that insulin resistance, a woman who has PCOS, there's a 50 to 80% insulin resistance rate in women with PCOS. Hormonal imbalance, 90 to 95% of women do not ovulate. Hyperandrogenism, so that unwanted hair growth, increased testosterone in our bodies. There's a 60 to 80% of women with PCOS suffering of hyperandrogenism, and oxidative stress obviously also plays a major role in women with PCOS as well. Then remember, the signs and symptoms of PCOS will differ as our ages differ. So PCOS and symptoms present differently in different stages of a woman's life. So it will look slightly different in adolescents, adult women, and mature women. You can see there's just a bit of a breakdown of the signs and symptoms you may experience. So in adolescents, it's usually weight gain, that acne, unwanted hair growth, etc. In adult women, it's more obesity, dyslipidemia or increased cholesterol, infertility, and pregnancy complications as well. In mature women, it can get as worse as bad as type 2 diabetes, dyslipidemia, which is also cholesterol increase, cardiovascular diseases, and endometrial cancer. Okay, so here was just some of the study results that we found. Like we said, we did 13 proprietary clinical studies on Sinopol itself, and it included over 1,500 patients. So in terms of hormonal imbalance, there was a 44% increase in pregnancy success in patients undergoing IVF. Insulin resistance in PCOS patients, so there was a 43.8% reduction in insulin resistance. Hyperandrogenism, 40% reduction in the testosterone levels in our bodies. And oxidative stress obviously directly scavenges those bad or antioxidants, yes. So the bad
free radicals.
Free radicals, yes. So it also helps regulate the pro-inflammatory markers and reduces inflammatory environment.
Okay, so new format. The reason why we are here today, we obviously love Sinopol, the brand, but we are very excited to announce that it is now available in 2 formats. So we are not discontinuing the sachets. It's still a great product with its own benefits, but we are launching a tablet, very convenient if you don't want to drink and dissolve the sachet every day. You take the tablet. So as we know, as Kristen mentioned, Sinopol is indicated for PCOS and then healthy glucose metabolism, so insulin resistance. This slide is again just a summary on the product. So we love the pack. It's also gorgeous. It's a beautiful packaging. And like I said, it's a convenient way of getting your support in terms of PCOS and insulin resistance. So 1 to 2 tablets daily. That's it. And then also the nice thing is we actually received some questions in terms of fast-light technology for those who know, and I think we'll elaborate on it a bit further later on. But the tablets also contain the fast-light technology that is already in the sachets. So we didn't compromise there. Then just in terms of, before I get to the differences, in general, the key ingredients in Sinopol as a brand is myo-inositol, alpha-lipoic acid, and then folic acid. I think the majority of insulin resistance patients and PCOS patients do know about myo-inositol. I don't think everyone is as educated on the benefits of alpha-lipoic acid, specifically our alpha-lipoic acid in fast-light technology. But just to touch a bit on these key 3 ingredients before we detail it a bit in terms of the sachets and the tablets, myo-inositol is known to act as an insulin sensitizer, a secondary messenger for insulin. It does help reduce insulin resistance. Alpha-lipoic acid is a powerful antioxidant. Kristen mentioned we want to fight free radicals, critical in a situation of a PCOS patient or metabolic syndrome or hormonal imbalances. Alpha-lipoic acid also helps glucose metabolism or glucose control. And then folic acid, despite numerous benefits of it, if you are trying to conceive, we know folic acid is critical for tube defects to avoid that. And then just in general to reduce homocysteine levels, and not to get too technical, homocysteine levels that are high or bad, and we want to bring back the balance. So these are the key 3 ingredients in Sinopol as a brand. If we move on, just might get my cursor, just in summary, just what I explained now. If you look at each row, you first have alpha-lipoic acid, then the myo-inositol, and then folic acid. So you can see the formulation addresses insulin resistance, hyperinsulinemia, hyperandrogenism. Those are your male hormones, as Kristen mentioned. The homocysteine is the next one, which we want to decrease with folic acid. Then oxidative stress, neural tube defects, and then ovarian steroidogenesis. I don't know how to pronounce that correctly, my clinical pronunciation. But the key point here is that we address all factors in terms of a metabolic syndrome, hormonal imbalances, and that at the end of the day also influences PCOS or a PCOS patient. So the key difference between the two products are, and to be clear, there is no one better than the other. It's really patient specific, also how a healthcare professional would like to prescribe it in terms of quantity in the formulation. So looking at the sachets, we know it contains alpha-lipoic acid, as we mentioned, in the fast light technology. If you look at the little image there of the dissolved sachet, you will see these little granules. Those are the microencapsulated granules in our product, which causes, if I can say, the fast light technology. That is the technology, so it will never dissolve. The consistency of the solution also gets a bit thicker. That's where the magic sits, and I think Kristen will explain a bit later on the fast light technology. Then the myo-inositol in the sachets are more versus the tablet. So if the patient requires more myo-inositol, you would head towards that side. And then we know it's obviously in a sachet format, 1 to 2 sachets per day. For the tablets, and like we said, very convenient, you take your 1 to 2 tablets per day. So the tablets are also technologically advanced, if we can call it that way. Despite also containing the alpha-lipoic acid in fast light technology, there are 2 layers in the tablet. We'll show you a bit later what it looks like. So there's a fast release layer and then a slow release layer. The total tablet split in both layers, so 400 milligram in the fast release and 400 milligrams in the slow release of alpha-lipoic acid is also 800 milligrams then as a total, so that's pretty much the same as the sachets. However, there is additional, as you can see highlighted, betaine in the formulation, vitamin B6, vitamin B2, and vitamin B12. Kristen will explain further on why we chose these ingredients. However, the benefit of the tablet is that there is a bit more additional insulin resistance support for the patient. And then, yeah, key thing is convenience as well. So it brings the offering of some additional insulin resistance support, and then we'll address the further benefits.
And preference at the end of the day as well. So maybe you don't like a sachet or taking a liquid. For me, always it takes so long to dissolve in effervescent format. So I just like popping a tablet. So we basically just giving you another benefit offering.
Yes, serving the consumer and
100%.
making it, giving you a choice of what you prefer.
Definitely. So as I quickly mentioned previously, why the additional ingredients in the tablets? So we have the 3 key ingredients as previously mentioned, but then the added benefits of betaine, vitamin B6, B2, and B12. So betaine, there's actually numerous clinical literature available in the support of insulin resistance and glucose metabolism. So like I also previously mentioned, so maybe you do not want to take this for PCOS, maybe you want to take this mainly for insulin resistance. This will mainly be your choice. And then also betaine supports liver function and helps supports digestion as well. In terms of the vitamin B groups that we've included here, like initially said, Sinopol is a health supplement, so we actually replace depleted vitamins. I'm sure everyone also knows the benefits of taking B complex or B vitamins, but then also these selected B vitamins influence hormone imbalances according to relevant clinical studies as well. B6 contributes to homocysteine. I said high homocysteine levels bad, and then also it regulates normal hormonal activity. B2 also antioxidative stress, so assists with the reduction of free radicals. And vitamin B12 is that energy vitamin that you need, so energy yielding metabolism that also plays a role in normal cell division.
Okay, then you know what the tablets look like, and as I mentioned, there's also a bit of technology involved in this product. So there's some photos of the tablet. I actually have a sample here on the table, but we'll rather show them on the slide. So you can clearly see the 2 layers that we refer to. This is just for the patient's reference to show the technology that's used in the product, and then the fast release layer and then the slow release layer. As you can see, the fast release layer, you also have your B vitamins there. We know, like Kristen said, energy that also comes with that, so it just makes sense. And then your 1000 milligram myo-inositol for your total dose for the day in your slow release layer, and then additional alpha-lipoic acid. But not to get too technical, we just want to show off a bit of the technology, despite the fast slow technology that's been used, of what the tablet looks like.
Definitely, and I think also important, remember, sometimes when people take the tablet out of a pack, you know, it is normal to have these little specks. It is kind of a model tablet, so don't get scared.
Yes.
It's the way it should look like.
Thank you for that.
Yes. So just in terms of what makes Sinopol different from other products on the market, and I also previously explained a little bit about the fast slow technology. So we know that alpha-lipoic acid has got a very short T half-life. So not to get too technical, but what it means is it's actually excreted out of our bodies quite quickly. And that's why we need that initial burst, you can say, of alpha-lipoic acid in the quick, fast release part of the tablet as well, but then also the slower or the delayed release of the alpha-lipoic acid to sustain that release of alpha-lipoic acid over a 24-hour period. Like also just mentioned, we've got 13 proprietary clinical studies on our product itself. So not just merely literature-based. And then also with the tablets, we are actually the only product currently on the market that's got the added betaine as well. Just an illustration of the fast slow technology, so we won't stick to this slide very long. But on the left side, you can see that in a normal dosage form, the alpha-lipoic acid is actually excreted very quickly out of your body. And then on the right-hand side, you can see that with obviously a 2-tablet dosage, if you wish to do so, it is actually sustained release throughout a 24-hour period.
Okay, then where can we find the product? So Sinopol Sachets currently are already in the scheme, Clicks, Medirite, all these pharmacy groups listed here on the screen, and then independent pharmacies nationwide. The tablets will also soon filter into market and will be available in the majority of the stores, but whenever there's a struggle in getting hold of stock, just reach out to us and we'll gladly help you get hold of some stock. Then social media, we know we are connected through social media. We know there's so many platforms and groups, support groups of PCOS, insulin resistance related, hormonal related imbalances. It's actually interesting what the community online is as well. So we really want you to join our online community. So on Facebook, you can find us. We updated the Facebook to the new look and feel in case some of the old users of the product don't recognize it. And then the Instagram that we launched recently. So please give us a follow there. And we do post some nice educational content also very quite often.
Sure, and I think just in conclusion, remember our tagline, bring back the balance. That's what Sinopol is all about, a health supplement, complementing your own healthy body. It's now available as a second offering, as a tablet as well, not just the sachets. Remember that we are different than the other supplements currently on the market with our patented fast slow technology specific to that alpha-lipoic acid. And then also remember, a healthy lifestyle always works synergistically with what the medicine you are taking or health supplements that you're taking. So lifestyle factors are always important, things like diet, exercise, stress management, which is sometimes a little bit difficult in life, but we do our best with it. And then look out for the signs and symptoms. So those signs and symptoms that we previously presented in different stages of a woman's life. And then also side effects. So as with any products, remember that any product can have a side effect. So if report it to your healthcare professional, and then currently maybe just a notice that the current side effect known for Sinopol is mix that of low blood sugar. So something like dizziness, headache, sweating, but there are no current interactions. But always good to reach out to your healthcare professional, or please pop us a mail, and I'm sure you've got all our details. So please interact with us. And like I said, please post and comment. And yeah, we're looking forward to hearing from you.
And remember, the tablets are not replacing the sachets.
Not
It's
at all.
to give you a convenient additional option and some additional insulin resistance support.
Okay, perfect. Thank you very much, ladies. I really appreciate it. I just want to say that the reason why we do these talks on something like a product like Sinopol is there are so many women out there that don't know they have PCOS. So talks like this is actually informing them and educating them on look out for these signs and symptoms. If you have acne and you're like, well, I'm in my 30s, why do I have acne? Or I'm just gaining weight all the time, or hair loss or unwanted hair. There's so many other things as well. Maybe this is something to look into. Go and get the test done. And and you also remember that something like this is when you're taking something like Sinopol or anything, when it comes to PCOS is something that it's a lifelong, how can I say, I'm beginning my words here. But you've got to, it's maintenance, you're maintaining when it comes to PCOS. So it's something you've got to keep on doing, keep on taking to help you along. So thank you very much, ladies. I really appreciate it. I love your product, always loved your product. Even before you ladies were on board, we loved using it. And I know we do. If you guys can't find it, let me know and I'll happily help assist you guys in getting the product. But I know I have seen it in most of the pharmacies around, and it's well priced as well. So yeah, thank you very much, ladies. Do you have anything else to say before we finish?
Yeah, I don't think so. I think that, like I said, the only thing to remember is bring back the balance. Like you said, everything is about maintenance, trying to get that work-life balance that we're all striving for as well. So we're just assisting in that strive for actually that balance.
Okay, perfect. Thank you very much, Anne. Thank you, Kristen. Really appreciate you guys. And we chat to you soon. Thanks, guys. Bye.
Thank you.
Bye.